Thousands of coronavirus sufferers whose results went missing in an Excel spreadsheet blunder still haven't spoken to contact tracers, Mr Hancock admitted today. The Health Secretary said just 51% of the 15,841 people whose results went astray last week had been contacted by the Test and Trace service by 9 a.m. today. That means 49% of them still haven't told the authorities who they might have exposed to coronavirus up to 10 days after they first tested positive. It may now be too late to track down the tens of thousands of people they exposed to COVID-19, as those people may have already contracted the virus themselves and infected others. Shadow Health Secretary Jon Ashworth said as many as 48,000 of those people's contacts had been not traced and were not isolating. He told Mr Hancock in the House of Commons, "Thousands of people blissfully unaware if they've been exposed to COVID, potentially spreading this deadly virus at a time when hospital admissions are increasing and we're in the second wave. This isn't just a shambles. It's so much worse than this. It gives me no comfort to say it, but it's putting lives at risk and he should apologise." It came as the Health Secretary admitted hospital coronavirus admissions are now the highest since mid-June. Some 12,594 new positive cases were recorded yesterday. Public Health England admitted they had missed 15,841 cases from the tally between September 25 and October 2. While people were told they were positive, the cases took days to show up in official figures and were only passed to contact tracers by 1 a.m. on Saturday. It's understood the glitch was caused by officials using an outdated Excel spreadsheet format which was not capable of displaying all the lines of data. The data was Pillar 2 data, which is overseen by the Department of Health. Mr Ashworth demanded to know why public health chiefs were using Excel spreadsheets. Why aren't they using specialist database software, he asked. Mr Hancock said they were using a fee legacy system which had already decided in July to replace. Mr Hancock told MPs an investigation had been launched, but he complained to Labour MP Stella Creasy, "I think it's wrong, though, constantly to be picking on a small number of the many cogs in the wheel that we have of this system." Close quote. And she looked aghast as Mr Hancock claimed he liked her. She was normally reasonable, and he'd be happy to give her a briefing in private. He also gave short shrift to Labour's Richard Burgon, who asked, "Will the Secretary of State do what's needed, kick out Serco, sack Dido Harding and put the billions of pounds wasted on private companies that are failing into our NHS that will do the job properly?" In one word, Mr Hancock replied, "No." Close quote. The revised case count sent coronavirus rates surging in hotspot areas, with Manchester now having 495. 6 cases per 100,000 people, up from 223.2 in the previous week. Yet Mr Hancock said Chris Whit, England's chief medical officer, said the impact of the disease had not substantially changed based on the new data. Mr Ashworth accused the government of failing on the basics on testing. He said, "The Prime Minister told this House on 20th May we would have a world-beating system in place by June. It's now October. The system is neither competent nor improving. Problems are getting worse. The government is failing on the basics. When will he finally fix this mess?"